Hello, everyone. Thank you all so much for joining this amazing panel. We're going to give folks a few minutes to join and to share the live. I'm going to ask our panelists to share the live. It's on the Vaccinations page. And then we'll get started shortly. All right, thank y'all so much for joining. We're gonna get started. Again, my name is Santra Denis. I am the president and founder of Vaccinations. We are a movement for Haitian American millennials born stateside to preserve Haitian culture and to build economic and political power in South Florida's Haitian communities. We're super excited to be having this conversation this evening with such a phenomenal panel of experts. And I just want to pause and say one of the biggest goals for Vaccinations is to really highlight the experts in our community that look like us, that sound like us, because there's a narrative about our people. And for sure, we're excited that these folks demystify and debunk many of the narratives that are told about Haitian people. And so super excited to be talking about Haitian millennials and vaccine hesitancy. And it's not something that is specifically unique to our community, but it's something that millennials they are really struggling with. And so definitely want to have a candid conversation, judge-free zone, but also want to be responsible with the information and the expertise that we have to be able to share it with our communities as well. I'm actually going to start by asking everyone to share the live, but also to introduce our panelists, who are amazing, beautiful, intelligent women doing amazing things in our communities. I'm going to start with Joanne. Joanne, who is a PhD student at FIU, who is known to do so many amazing things as it relates to public health, disaster resiliency, has worked with groups not only stateside, but internationally in our and really is all about all things community, all things public health, all things making sure that our communities are resilient. I'm going to also pass to Dr. Cassandra Bazile, who is a PhD student at I'm a Gator, but we'll give some love to Cassandra, who is studying immunology at We're super excited to hear all about what that means. To also share that amazing field with our participants today. I'm gonna pass to my fellow Gator, Dr. Nicole Nicophene, who is amazing, has been practicing family medicine, primary health care for over 10 years, really got her start, I would say, at the federally qualified healthcare centers. And this is where folks who are working class, low income folks have access to healthcare and really are on the front lines with many members of our communities, really making sure that they get access to quality healthcare. Currently, she's at Chen, really working with geriatric patients. We're super excited to have you as well. Lastly, we're going to go to our board member, Ludmilla Paul, phenomenal woman who is all things technology, information, and public health as well. And so again, so many experts in our community. And because there's so many experts in our community, we also know that we hope that there's also trust and understanding in what folks have to share and offer today as we talk about this complex subject around vaccine hesitancy. We're actually going to start with our home country, Haiti. Joanne has built a dashboard to really track what is happening with COVID in Haiti. And that's extremely important to us because we know that as things and crises happen in Haiti, it impacts the diaspora, specifically the South Florida diaspora that has the largest numbers of Haitian folks living outside of the country. And so I'm going to actually pass to Joanne to talk about COVID and what's happening in Haiti. We know for a long time, folks were like, it's the tea, c'est gingemna, it's the outsourcing. C'est ça qui fait Haïti pas joindre, but we see that numbers are really going up. And so I really want to talk about that so that we don't only have information for ourselves, but we have information for our families in Haiti as well. Go ahead, Joanne.
All right, thank you, Santra. Bonsoir tout le monde. It is a pleasure and honor for me to be sharing this space with amazing speakers tonight. And I also am grateful for those who are joining us from the audience. So I'll be sharing my screen. Okay, so first I want to go over a couple key points that led to the development of this dashboard. Even just here in the US, which is seen as a country with lots of resources, our communities, and I'm speaking on behalf of the Haitian community, has had a challenge with regards to having access to information, whether it be whatever the county government is releasing, what maybe your district might be releasing, or whatever information you're able to get from your family over the radio. Unfortunately, it's a recurring issue. That is, there is not a centralized system where you can have access to any data that will help you in making informed decision when dealing with disasters. So the goal with this dashboard that I put together was to at least provide some insight in a concise and clear manner that would help our Haitian, either in Haiti or in the diaspora, to have an idea of what is happening in the country in Haiti and what are some gaps or question marks that are coming up in what we are observing in the data. So the website is COVID-19Haiti.com. So I encourage anyone to go and check it out. And any feedback is also welcome because this is an ongoing, this is a work in progress. So there's one quote that I really like. Oftentimes when we hear about data, it can be intimidating because the way how it's presented can be really complex. So the greatest value of a picture is when it forces us to notice what we never expected to see. But in order for us to do so, the information needs to be presented in a way that is easy to digest. And unfortunately, when we're dealing with lots of data, unless you're someone working in the research field, it might be easy for you to understand that information. But when we think about our community members, our friends, our fellow Haitians, or anyone else from the general public, it can be intimidating and also confusing with regards to what the data is actually telling us. So when I work with data, it's always about the what is the issue? And in this conversation we're having tonight, we're talking about COVID-19. Why? Like, why is it important to have access to data? Why is it important to have access to clear and digestible information? And how do we present that information in a way that we can actually relate, connect, make decisions based on the answers or the findings, and also take that information and disseminate it or share it with others in circles that we are part of. So how it all started, I've been tracking COVID data in Haiti back from March 2020. And every day, whenever the Ministry of Public Health would release information, I would record that information. The reason being is when we think about the infrastructure that we have in Haiti, either it's impossible to have access to information because they're not made public or maybe they're not collected. And there's a lot of uncertainty around when that information is published, is it actually going to remain published forever? So that was one motivation for me to begin tracking that information, because with my experience in infectious disease, especially pandemics such as Ebola, I've had the opportunity to understand the importance of tracking trends and the development of any potential disasters within communities or across borders. And then with that information that is being collected, what patterns are we seeing? Are things spreading? Are they getting worse? Is there a trend that is, are we seeing clusters or outbreaks in specific geographical region of a country or a town? And how do we consolidate that information that we're receiving, and how do we simplify the way how we're reporting that information so that it makes sense to whoever needs to receive that information. And at the same time, how easy is it for your audience to actually have access to that information? So here I have a screenshot of what the dashboard looks like, and there are different categories of information that this dashboard addresses. So the map on the top left pretty much provides a breakdown of hospitalizations. So how many individuals are currently in the hospital in each department? How many hospitalizations have we had over the past 7 days? And how many hospitalizations have we had over the past 14 days? Now, because this is an image, I cannot show you how those numbers would pop up. But if you go to the website and you bring your cursor over any of those circles, it will automatically pop up a small window that will give you a breakdown of those numbers. The map at the bottom is giving us a breakdown of the confirmed cases based on the latest report from the Ministry of Public Health in Haiti, including the total number of cases confirmed over the past 7 days, the past 14 days, and the overall total numbers since the Ministry of Public Health began tracking COVID cases. Now, we do know that about a month ago, the Haitian government has received about 500,000 of COVID vaccine doses. So there are hospitals and other locations that have begun to administer those vaccines. So that's something else that I'm tracking in the dashboard. So anyone who has access to the internet, or anyone for whom it is easier to have access to information by going on the internet, can look up what those locations are, and if you're required to make an appointment, and what the hours of operations are for those locations. But one thing that is really fascinating to me, and that's where we can see some of those gaps or inconsistencies in the data. The blue bars that you're seeing at the bottom of the screen indicates the number of new cases per day. However, when you're looking at the number of daily tests that are being administered by that are being administered in Haiti, there is not a clear pattern where, let's say if there is an increase in number of confirmed cases based on number of individuals who got tested, there's not a, if we are seeing an increase in positive cases, one would expect to see an increase in testing. However, that's not the case in Haiti. So the gap with that is that we do not have a true picture of what is actually going on in Haiti. And when we think about the number of travelers that are coming in country, especially those flying from areas where we have hotspots, such as the state of Florida, which is currently the epicenter of COVID-19, I think it's really critical that this is an opportunity, if there's an option to revamp the way how tests are being administered, we can have a more accurate understanding of what's actually happening on the ground. And lastly, I've talked about visitors. We live in a world with globalization where we are more connected than we used to be before, either by flying or either by moving across places through ground transportation or over water. So when we're dealing with pandemics, when we're dealing with infectious diseases, as the migration or movement of individuals increases in an environment, so does the risk for any virus to travel from one area to another. So I've also been tracking the number of recorded visitors in Haiti by air. So we know we have 2 major airports in Haiti, one in Cape Haitian and one in Port-au-Prince, and also by ground. So that's most likely individuals who are crossing the Dominican Republic-Haiti border. And if we're looking at the the total number of visitors that have come to Haiti over the past 3 months, being May, June, and July, that total number, monthly number, is around 31,000 and 37,000. So those are recorded visitors. And we know what the infrastructure is like in Haiti. We do not know how many individuals might have come by boat in country or have crossed the DR Haiti border without being registered. So when we're dealing with an aggressive lethal variant such as the Delta variant, it is really important that transparency be included in public health planning. And it is really important that this type of data is also collected so that when we're making public health decisions, those decisions are properly informed. So I'll stop here. And the goal with this dashboard is to identify those gaps and to also inform those who are accessing that information.
Thank you so much, Joanne, for that, grounding us in the information and what's happening in Haiti. If you'll drop the dashboard in the chat, we'll be sure to share it out as well so that everybody can follow up. And also, if there are hotspots where your families are from in Haiti, for sure, I think we should do our due diligence and make sure that we communicate that with our families so that they can keep safe as best as they can in Haiti as well. So, Munio, the previous president had told us that by Easter 2020, we would be out of this, that COVID will be done. And here we are, August 2021, with a Delta variant, with things spiking in Florida like crazy. We had Rolling Loud. We've been having so many festivals and concerts. I guess, I want to start with you, Cassandra. How did we get here? What is this pandemic thing? COVID, man-made, not man-made, all the things that we're hearing. How did we get here? And I'm going to also ask Dr. Nicophene to follow up as well.
Yes. So, that's a really good question, a very complicated question as we're all figuring out. But I think the way that we got here in the first place has a lot to do with what immunity is. And when you introduce a virus to a population that has no immunity towards that virus, it allows that virus to, gain legs and spread. So I think it's really important to understand the concept of what immunity is and why it's important that we foster immunity within our community, whether it be through vaccine or exposure to the virus, which we don't want to be exposed to COVID because we see how dangerous it is. So what I study in my PhD is microbiology and immunology. And those two arms go really well together because microbiology is the study of microorganisms. Some will say that's mainly bacteria, but it can also include viruses. And then the study of immunology is the study of the immune system and how it responds to microorganisms such as bacteria and viruses. So the way that your body initiates immunity with an organism, such as bacteria, is typically when your body's introduced to it. And as kids, we get sick a lot, and kids are constantly sick. They get common colds, they get fevers, and that is because they're gaining immunity towards the new bacteria and the new viruses they're experiencing throughout the day. But when something new like COVID-19 comes around, something we've never seen again before, we have no immunity towards it. So we all tend to get sick with it. The bad thing about COVID-19 is that it's a respiratory infection, meaning that it's very dangerous and has a lot of adverse side effects, a lot of side effects we don't know. So to simply answer your question, the way that we got here was a new virus was introduced to a population that has no immunity towards it. And what vaccines do is they foster immunity within us. They give us, a portion, they give us a way for our body to see the virus without actually getting the virus.
That makes a lot of sense, at least to me, public health. Definitely going to ask Dr. Nicophene to come in as well. Specifically, you work with geriatrics folks. You've also worked in federally qualified health centers. How would you describe what we're experiencing to your patients?
I would say it's very difficult for them, very stressful, devastating. I've seen a lot of patients heartbroken. I've seen a lot of patients come in with family members who have died as related to the vaccine, or sorry, as related to COVID. And then what made it a little bit more difficult is the fact that you can't go to their funeral. We have to socially distance. There's been a lot of funerals being done by Zoom. If they're in the hospital, you can't visit them. So to compound the difficulty of dealing with this virus, there's also difficulties with getting in touch with that family member that might be dying. So this has been a difficult year for all of us. And I've definitely seen a lot of devastation as a result. But there's been a lot of hope since the advent of this vaccine. So I'm so excited that we get to discuss that today.
Thank you, Dr. Nicophene. Joanne, do you want to also talk about some of the coalition work? I know you've been giving updates in terms of where we are as a county, where we are in South Florida, or as a state, excuse me. Do you want to talk a little bit about that as well so we can ground ourselves? How did we get here? Where are we currently? People thought it was a hot girl summer. It was looking like we need to be in the inside. So talk to us about what you're seeing as well.
So what we know is the state of Florida currently is seen as the epicenter of COVID-19 because the Delta variant is now the dominant variant in the country. But at the same time, the state of Florida has broken several records, being that we've had the highest number of new recorded cases, the highest number of hospitalization. But what's a little worrisome is the school year is about to open, and there's a lot of conflict around whether there should be a mask mandate for kids going to school. At the same time, there's when we look at how many individuals have been vaccinated, not just here in the state of Florida, but across the country, as communities together, we are not where we should be. The original goal was to get 70 to 80% of the population vaccinated. But as of now, we are roughly at 50% fully vaccinated. However, we did hit a big milestone yesterday. That is about, I think we're close to 70% of the population qualified to get vaccinated, having received at least one dose of the vaccine. Which is a good sign. However, when we are dealing with aggressive variants like the Delta variant, and when we are not in a position where we are nowhere near reaching herd immunity, there is the opportunity for other variants to emerge. And I know about 2 weeks ago, there was an interview that took place with a doctor, I believe it was from a Miami hospital, where there's another variant which is believed to have originated from Colombia. It does not have a Greek name yet, but 10% of hospitalized patients had that variant. It's not clear whether that variant is as aggressive or as lethal as the Delta variant. There are ongoing investigation happening on this particular variant. So what's really important, I would say, in my opinion, is, counties, states, the country needing to have the right leadership so that public health is put as a priority as opposed to any other elements. Otherwise, if we cannot protect our communities, then the healthcare system is going to be stretched thin, which I believe they are already in that position, considering that we are way over a year into this pandemic. Unemployment is going to continue to linger. We are also dealing with this whole housing eviction potentially. The latest news this afternoon is that the White House was considering extending that moratorium for another 60 days. But several sectors are still being stressed by this pandemic.
My God, I mean, at least for me, and I'm going to come to you, Ludmilla, I think at least for me, we have to, I say this to all my friends. Me and my sister talked about it this weekend. I didn't get the chicken pox because I didn't get it, and then I got the vaccine and never got it. And now we're hearing there's going to be a generation of children who never experienced chicken pox, in the same way that we're a generation of young people who never had polio, a generation of young people who never had smallpox. I like to believe Haitian American millennials and just millennials in general, we're the vaccinated generation. There are so many things that our predecessors or the generations before us experienced that we just don't know, we will never experience. And I think we are so much better because of the advances of science. And so I wanted to name that and ask Ludmilla to come in on your thoughts about that as well, in terms of where we are, how we got here, people, so many things. But for sure, I want to ask you to come in as well.
Gotcha. So happy to be here with you all and just discussing public health and how to keep everyone safe and getting that correct information out. So I kind of want to take a big picture view and kind of think of public health as all of the things we do to prevent people from getting sick, all of the kind of non-clinical, non-doctor healthcare services aspects of that. And so the first piece is the federal government is always kind of doing like disease surveillance and kind of looking at emerging diseases. So under Barack Obama, we had H1N1, swine flu, Ebola, and it never got to this level because we had the infrastructure around disease surveillance, so that as soon as there was that initial case of Ebola in Africa, as soon as that person landed in Texas, I believe was the index case, at the airport, there was already CDC, hospitals, doctors there to kind of contain it and just treat that patient to prevent the spread of Ebola. And so one of the paramount aspects of public health and infectious disease is to just contain it before it spreads. And so before we had the chance to contain COVID before it spread, a lot of kind of like the usual public health infrastructure, personnel that are just kind of in different countries that are monitoring different environments. We didn't necessarily catch it and contain it as early as possible. And outside of that, going back to Joanne's point about globalization and travel and diseases and viruses are going to spread faster just because we travel more, we're more connected than before. And so that really requires a level of disease monitoring and really investing in our public health institutions that do a lot of the background work to even prevent health systems from seeing surges in certain diseases.
I mean, I think that's phenomenal. So much of our privilege is that these things are happening and we don't even realize it. We don't even know it. They just happen without, us even thinking about, hey, it's flu season. There's so much going into the infrastructure to prevent as many of us to get the flu. Hey, it's a season for something else. So much is going into our infrastructure to prevent us from getting certain diseases. I also remember South Florida, specifically Miami, what was the name of the thing? It was impacting pregnant women. Help me out, public health folks.
Zika virus.
The Zika virus. And again, you saw all types of resources, all kind of infrastructure set up to really contain that so that it didn't have lasting impacts. And so we just got to be very mindful of what the advances that have been made, the privilege that we have for these things to be happening without us even thinking about it, because they are here. And perhaps we could do even a better job to really ensure that everyone understands how healthcare is working and the infrastructure is working, even when we're not thinking about it. It's something that I want to also mention as well. As we kind of continue to have this discussion, and for sure, y'all chime in if you want to chime in on something I said, feel free to, because it's definitely a conversation. Dr. Nicophene, I know you're not necessarily in the ICU, but I know that for sure with your peers, people you talk to, even travel nurses, people who've been on the front lines, they can really, the things that they have seen. Are you able to speak to any of that in terms of where we are and what's happening in the healthcare sector as relates to COVID?
So there was a lot of changes, obviously. People who are on the front lines in the hospital, very difficult, working very long hours, exhaustion, watching very difficult cases, people dying. There's been a lot of depression among healthcare workers. And even I, not in the ICU, being available by telehealth, being available to my patients 24/7, treating my patients from home, trying to keep them out of the hospital, calling the ones who have COVID, calling them daily, monitoring them. It's been a lot on the healthcare system. And lots of changes happened very quickly. And again, I think that overall, we did a really great job of just responding to this difficult pandemic that came before us that no one was expecting. And right now, what we're seeing is 99% of the patients in the hospital right now are unvaccinated. So COVID has become the disease of the unvaccinated. If you're vaccinated, fully vaccinated, you're 96%, it's 96% effective. So that means 96% of people who get the vaccine will not get COVID. But one of the very important things that I feel like is not discussed enough is the fact that it's 100% effective against severe disease. Because patients will say, or people will say, well, what's the point in getting the vaccine if I can still get COVID? Well, the point is that if you're the 6% who gets the vaccine, who gets COVID despite having the vaccine, you're not going to end up in the hospital. You're not going to die because it's 100% effective against severe disease. So that's why right now, 99% of the patients in the hospital with COVID are unvaccinated, because our vaccinated people who might have COVID do not enter the hospital. So that's what we're seeing now. I have a lot of my friends and even articles that I've read anecdotally of doctors saying that when the patient gets to the point where they can't breathe and they're ready to put the tube down their throat, the ventilator to breathe for them, this is when the patient's saying, can I have the vaccine? And unfortunately, at that point, it's too late. So at that point, the hope is hopefully your friends and your family who see where you're at, they will get vaccinated. But at the point that you have the virus, it's too late to get the vaccine. A lot of the times the patients are saying, well, we didn't know, we thought it was a hoax, we thought it was a GPS monitor, we thought it was marque de la bête, we thought it was a chip. Unfortunately, there's still the consequence to the decision that you made. So we're showing all types of evidence that this is not a microchip, this is not marque de la bête, this is something that is very effective and it's working. And that is why our numbers were able to come down. And even with the Delta variant that people are so afraid of, there is still great protection. It's in the 70%, I believe, against the Delta variant. So the way to fight these variants, as Cassandra had said, and Ludmilla, as well as Joanne, is to get everybody immunity. The sooner we wipe this virus out, then there's no more opportunity for this virus to mutate and form new variants that can come and attack our immunity. So right now, that's what we're seeing, that this virus right now is a disease of the unvaccinated. And that's why it's so important that we all know that people are aware of that when they're making their decision about whether they would like to be vaccinated or not.
Yeah, right before I come to you, thank you so much for that, for offering that, Dr. Nicophene. I think we got to always go even deeper, and that not only are the folks who are unvaccinated, not only do they end up in the hospital, and oftentimes it's fatal, It's also folks who don't have money, right? Who look like us, who, when the bills come, who are, just shouldn't have to take on more stress than what they're already dealing with, right? So these are folks who are all also possibly, and I would go on the record and say it, housing insecure, may not necessarily have been in contact with the primary care consistently. And so these are our folks that we know that the family can't take that hit if they go to the hospital and if something happens. And there have been so many of our, they said the baby boomers have really taken a hit, but millennials, we're in the hospitals now, right? We've lost so many people in our community due to COVID. And I think that we have to take that really seriously, not only as a result of like the folks that we've lost, but what it means for a community when you lose people who were contributing so much to their families and to their community as well. And those are hits that I don't think we should take lightly, that, powerhouses, folks who, because their children didn't say, hey, that vaccine is okay, didn't take the vaccine and are dead. Right? And that's like in our community that hits close to home, several instances, people who didn't make it before the vaccine came out, right? And so I know that we have to hold multiple things, and we just want to make sure that we're holding that. These decisions that we're making have consequences to families as well, and we got to be mindful of that. Ludmilla, I want you to come in as well. Go ahead, I see your hand up.
For sure. I wanted to kind of piggyback off of Nicole's point about, if you can still get COVID, why get vaccinated? And I wanted to put on my public health hat and really kind of discuss how there are levels of prevention. Like the first level is just making sure that you don't get it in the first place. The second level is making sure you don't get very sick from it if you do. And the third level, making sure that you don't pass away or die due to said disease. And I think when we talk about the vaccine works or it doesn't work, most of the time people are thinking about, okay, I'm never going to get COVID. I'm totally in the clear. I don't need to social distance. I don't need to wear a mask. I'm vaccinated. I'm good out in the world. And that's not necessarily true. You should still wear a mask because it's still transmissible. And so when we're really drilling that point home about what works and what doesn't work, really focusing on those different levels of prevention, and that, in the event that you do get it, you do get the virus and you're vaccinated, this third level of prevention, which is preventing you from dying, and next level below that, just preventing severe infection, having you go into the hospital and having to be supported with your breathing. We're trying to prevent that as well. So I think when we're trying to kind of guide people through that risk and that benefit analysis, that shouldn't I, is it going to hurt me? Is it harm me? Does the good outweigh the bad? Kind of leading with that point of what is it actually trying to prevent, which is severe infection and death.
Absolutely. Joanne, I saw Joanne's hand up, and then I'm coming to you, Dr. Nicophene.
I would add something else that's really critical is, with those conversations that we're having with like friends, families, neighbors, making sure that it's clear that everyone understands the advantages and limitations of the vaccine. So one thing that the data is showing us is that, yes, you have some protection against COVID-19, including the Delta variant, and you are less likely to end up in the hospital or dying of COVID-19 if you become infected. But I think what's a challenge is we have those breakthrough cases, and they can, if someone was considering taking the vaccine, those breakthrough cases can lead them to changing their opinion towards the vaccine. So I think it's really important to make it clear to individuals who are still unsure whether they will take the vaccine that there's still this window for you of getting infected. It's just that you will not end up in the hospital, and your risk is even almost zero for being infected. The second point that I want to bring up is if you're taking the Moderna or the Pfizer vaccine, which is a 2-dose vaccine, or the Johnson & Johnson, which is a single-dose vaccine, you are not protected until 2 weeks after your final shot of the vaccine. And there are some individuals who are under the impression that once they get the vaccine, if I take it today, well, boule la lampier metal lage de guidon, right? But that's not the case. You have to wait 2 weeks until your last dose to really build that immunity against the virus.
Thank you for that. One more from Dr. Nicophene before we get to Leonie's question.
Just wanted to further explain what that means when we say, you know, you could get COVID despite being vaccinated, but it's a less severe disease. It could basically you would get COVID, you're vaccinated, but it'll feel like a cold, or you'll be sick for 24 hours. So from that standpoint, that's what the goals of vaccines are. It's not necessary like for it to be 100% effective. The goal is to keep patients out of the hospital and prevent death. And that's how all vaccines are. That includes the flu vaccine. That's why a lot of times patients will say, well, what's the point of getting the flu vaccine? Because I still got the flu. Yes, you can still get the flu. However, the flu vaccine made your illness much less severe. In general, the flu should last 14 days. Some people end up in the hospital, get pneumonia, some people die. If you got the flu, despite being vaccinated, and you were only sick 48 hours, that's nothing. That is not what the flu is. The flu knocks someone out for 2 weeks minimum. So if you ever had the flu for less than that, thank your vaccine, okay? So I can give you an example today with one of my patients. She has cancer. She's 82. She's got stage 4 cancer. She's got bad lungs, all kinds of problems. She came in to me to see me on Friday for cold symptoms. She had the cold. But right now, anybody with any cold, you're getting a COVID test. She's COVID positive. She has COVID. She's fully vaccinated months ago. I called her today. I'm following her daily. And she's like, it just feels like the cold. And I said, you know why? Because of the vaccine. At 82 years old with stage 4 breast cancer, bad lungs, asthma, this should be much worse. Thanks to the vaccine, it just feels like a cold. And I'm just giving her cold medicine. And she's at home, and I'm just going to call her daily, follow her. She's not short of breath. So that's the difference there with the vaccine.
Thank you so much for making that plain and simple for us, Dr. Nicophene. I think I had the flu once. I literally was on my deathbed, 2 weeks down and out. And so these fake symptoms that y'all think y'all really about to die, but you took the vaccine, it's not the real flu. So I really hear that. Also too, we're gonna answer Leonie's question, and then I want us to transition to how do we address fear of the healthcare industry, the history, but also be very mindful and appreciative of facts, right? And so we're gonna do that balance. Leonie's question in the Facebook group is, what's happening with children? And so anyone can take that. Are children being hospitalized? Are they getting sick? What's going on with the babies? Cassandra, did you want to take that?
Oh, yeah. So I just wanted to add one more thing about the last thing we just talked about. So in addition to the vaccines protecting us from getting sick, they also protect us from spreading the virus, which I think is a very important point to make, because if you're getting the virus and the virus isn't able to latch on and infect cells, that means that you have less replication of the virus, meaning that the virus won't spread as readily and as easily. And even if it does spread, it won't be a case of it spreading like the person that gets it won't get like a lot of virus, essentially. So I think it's really important to know you're protecting yourself, but getting the vaccine is also protecting people around you because they can't get the virus from you likely. And what I've read about children and COVID right now with the Delta variant is that the Delta variant is actually infecting children at a higher rate than the previous version of COVID. And that has to do with, kids are less likely to be vaccinated at this point. The vaccine first opened for people, I believe, over 16 years old. but now it's spread to children can now get it. So there is still a lag of children getting the vaccine. Also, there is that invincibility, that, young adults tend to have, and we tend to be the ones that go out more. So I think those are some reasons why we are seeing it in younger people right now. And I also read that they aren't necessarily more at risk, like old people who have like a declined immune system, but there are risk factors involved, like vaccination and just being out more.
And I also like for someone else who wants to talk about children, are they carrying it or spreading it to other folks of their family? And if we don't know, we can definitely follow back up with folks who are more in pediatrics. But definitely wanted to open that space to see whether or not anyone had some information on what's happening with children, because we know the state of Florida, they've been talking about mask mandate for students. I know at least in Broward County, there might be rolling that back out because of pressures around funding for specific schools. So there's a lot of politics involved in that. And so definitely want to hear from you all.
I could add, this is me coming from the data side, addressing the what and the why. And this is to complement what Cassandra just said. I know end of last week in the news in the state of Louisiana, there were kids who were being intubated as a result of the Delta variant. And there are some children's hospitals that are near capacity because they're getting so many cases. Now, when it comes to why are we seeing a higher rate of young adults being infected or ending up in the hospital, my answer is based on my interpretation of the data. When we look at the rate of vaccination by age category, for example, in the state of Florida, we have about 80% of the senior population that is fully vaccinated.
What's considered senior? Sorry.
65 and up. I'm hoping I have not offended anyone by starting with the 65 number. If you're 65 and up, that population, we have about 80% of the population fully vaccinated. So I want to believe that could possibly explain why we are seeing more cases amongst the younger population as opposed to the seniors.
Yeah, let's talk about it because, not only do I have an MPH, this is how we get down, because we have the Googles, we have YouTube, we know everything. And so how do we reconcile an industry that historically we haven't had enough access to? Many of us go years, decades without really interacting with healthcare systems. If we ever do, we've heard many interactions with Black folks and interactions with healthcare systems in the past. How do we reconcile the history, but also what we know is true in terms of who's most at risk, what patients COVID is fatal for? How do we hold these things together? And what would you say to folks who are struggling with those two? Because I think a lot of it, and this is kind of like my soapbox, so give me 2 minutes. A lot of it is that, our communities don't know how to talk about fear. Like, we'll talk about, oh, I don't trust it, but we're not saying I'm scared, right? I don't know what this could do to me. And I don't want to deal with that. And so we don't want to be vulnerable and say that. But for me, I think it's fear. And we don't know how to also, the healthcare industry may not know how to respond to fear because that's not what people are saying. And so how would y'all respond to people who have real fear as it relates to vaccines and even the healthcare industry? And all of y'all can take that.
So that's a really complex question, and I'll do my best at answering it. But I do think it's important to address like the differences between science and healthcare, or and so scientists are making the vaccines, and then the healthcare professionals are administering the vaccine. So I think that people need to understand that it's not like the healthcare individuals are making the vaccines and giving them out and trying to implore some type of thing on their end. And I do think, it's the job of the healthcare professional to, teach the patient about, okay, this is what the vaccine's doing to the best of their ability, because there is some disconnect between, okay, what goes on in the lab and then what goes on in the hospital. So that's the first part. And sorry, was there a second part to your question?
Yeah, I think it was really around, and one of the comments is really around a distrust for healthcare systems as for-profit systems that focus on treatments and not cures. We just have a complete distrust of the industry. How do we
Right,
reconcile,
right.
that?
And with the vaccine being a preventative measure, there's not a real financial incentive to giving people vaccines, because you're preventing something from happening. Whereas there's a history of viruses causing long-term problems. So if there was a financial incentive, it would be, hey, get the virus and then live the rest of your life with the symptoms, or asthma and things that viruses do. So I really want to stress to people that getting a virus should never be what you want, because we don't know the long-term effects of viruses. For instance, HPV, the virus was first discovered, we thought it had no effect. We just thought it was something that, may cause genital warts, but just laid around and didn't do much. And then the more we studied HPV, we found that it caused cervical cancer. So I think, and that can take 20 years to happen. So it's like, if there's a way to not get a virus, you should just not get the virus. And even better, if it's a vaccine against the virus to help it actually gain legs and stay and remain in your body, then get that vaccine. And COVID-19 is so new. It was discovered in 2019. It's a baby. We don't know an inch of the virus at this point. So if you're able to get vaccinated from getting the virus, it's beautiful. And if you're able to, if you recover from the virus and you feel great, that's amazing as well. But I think in the next coming years, we'll start to hear more about people who've had the virus and recovered and symptoms that they're experiencing. And it's going to be really eye-opening to how little we know right now.
I think Cassandra, what you bring up is really the fear. It's that for so many folks, it's new. For so many people, they don't know. And I think that for us, it's that there's always, we're doing this probability game every day in ways that we never think about, right? This probability is like, yo, I can get in my car and not make it to work. I can get in my car and not make it home. I can get on this roller coaster and that be it for me. I can get on this flight and that be it for me. But what we're doing is also like, what is the likelihood, right? What is the likelihood that this can actually happen to me? And I think for us, it's like, what we've seen is that for folks who had the virus, for folks who got the vaccine, what the stats and what the research and what the data is telling us and what people's testimonials are telling us is that they survive overwhelmingly, and folks who don't, the probability of them dying, that's not the probability we want, right? And I just want to make it really plain around, those probability. What is the probability, Santra Denis? If I was unvaccinated, what is the probability that I can end up in a hospital and not make it out? It would shoot way up than if I was vaccinated, right? And Santra Denis is just me, but I also have responsibilities for my uncle, for my aunts that I see, because I'm an influencer in their lives, right? I'm say doctor, even if I'm not a doctor to them, right? And so we want to make sure that we also hold into consideration the responsibilities that we have as young people in our families and with our friends as well. Dr. Nicophene, your hand flew up. Let's go.
Yes, I thought that Cassandra's example about the HPV was a great idea. It was a great example because that's why we came up with the HPV vaccine, right? The Gardasil vaccine, because it prevents cervical cancer. Another example would be, that's why we have the chickenpox vaccine. Why? Because the chickenpox is a herpes virus. It's a herpes type of virus. It stays inside of your body. You've had the chickenpox as a child, but it stays inside of your nerve cells dormant, like it's asleep. And then it could get reactivated when you're under a lot of stress, you're elderly, you're sick, which is why we then came up with the shingles vaccine, because the shingles, which comes from chickenpox, is terrible. I mean, people don't really die from it, but it's horrible. It's very painful. It's burning. It's you lose a lot of time from work. It's devastating. Anybody who's had it, they all say, I want to get the vaccine so that I never get shingles again.
Yeah.
So that is an excellent example that viruses can stick around. They're unlike bacteria that you can kill off. Viruses can stick around, and then cause problems years down the line. So we don't know anything about COVID, like she said. And so that is an excellent reason for the vaccination. What should we do with the fact that we don't trust the healthcare system anymore? And I know that, I've seen that fresh out of medical school, first, internal medicine rotation, I noticed people don't trust doctors anymore. And that's been an ongoing thing during residency, during my practice. I've realized that I have to do everything I can to establish that trust between myself and the patient from day one. So that's very important. What should we do right now? I know we are all young. You don't necessarily have a primary care doctor that you're seeing regularly, that you trust and have a relationship with. One of the things is to educate yourself, right? Like what we're doing right now. All of you who are listening to this panel, who's going to provide this panel to other people, you're educating yourself. The other thing is to ask questions. When you have friends who are in the medical field, when you see people who are in the medical field, doctors, nurses, ask questions, but also don't just take their word for it, because I've had some nurses or doctors give information that was kind of questionable. Go and look it up for yourself, test it. It's kind of like, if you're Christian, we say, don't just go to church and listen to the pastor tell you what's in the Bible. You read the Bible yourself, test it. So know the facts. How do you do that? Do your research. Now you got to be careful with your research though. You have to be careful that you're getting your information from reputable sources. I have a cell phone, my Chin cell phone, which are my patients, they can reach out to me. Since COVID, we've been attached by WhatsApp. And so I get all types of videos from WhatsApp and pictures from WhatsApp. And this is where my patients are getting their information. This is where my parents were getting the information before I spoke to them. WhatsApp is not a reputable source. Just going on Google and typing it in and clicking on whatever first link you see go on there is not a reputable source. So I have 4, and I'll put them down on the chat, that I think are great sources if you're looking for medical information. WebMD. If you type WebMD, search in there, you're going to get accurate information. Medscape is a really good one. I use that myself. There's one for clinicians that I use, and I love it. I use it all the time. Cleveland Clinic. These are all reputable sources. These are all research-based, evidence-based medicine that they break down for the layperson. They break it down for someone who did not go to medical school or who does not know anything about research, who did not get a PhD. Mayo Clinic. So these 4 are ones that I would recommend: WebMD, Medscape, Cleveland Clinic, Mayo Clinic, to do your research whenever it comes to healthcare questions that you have. If you don't have access to a doctor that you trust, to do that. So like I said, first is educate yourself, ask questions, know the facts. And how do you know the facts? Doing the research, and make sure you watch your resources. Where are you getting your information? I think this panel is amazing that we're in. We are all in the field, researchers, doctors, MPH. This is a good panel to find that information. So if you're watching, then you chose a good place to find good information and resources.
Thank you so much. I see Ludmilla and I see Cassandra. I want to add to that. Nous avons tendance la caille nous nous penser que tout le monde a fait tout bagaille, right? It was really important for us to get folks who studied public health, health science, medicine. That doesn't mean that, they know everything about everything. It means that they are experts in this subject, right? Don't call Santra to fix your car, because guess what? Can't do it for you. I have braids in my hair. I can't do that either. I know what I can do and I know what I'm an expert in, right? And so I just want to make sure that we do that and understand that in our communities, because not only did Dr. Nicophene give us sites, there's also folks that we need to go back and check, where are they getting their information from? Are they experts on things? There are folks who call themselves doctors. Right? We know this is true. And so we just got to be very careful. A PhD, MD, different doctors, PharmD, different doctors. Just want to make sure that we are all talking about that. And that means everyone has expertise, but everyone can't be the expert on everything specifically in this. So we got to be very mindful of that. Let's come to Dr. Cassandra. I'm sorry, Cassandra, future doctor.
I'll take it. But yes, so I also just wanted to talk about, like, we were saying that COVID-19 is very new and we don't know much about it. And a lot of people I talk to who are, scared to take the vaccine say, well, the vaccine is new. And I think it's important to understand when the vaccine is actually developed, what it's doing, what it means, and that the vaccine technology around the COVID vaccine is not new. It was invented in 1990. And it's called the mRNA vaccine. And what that's doing is it's injecting mRNA into your muscle cells for your muscle cells to produce the protein associated with the virus. So an interesting thing about your muscle cells, they're called myocytes. Myocytes have pores in them that allow for things that are large, like DNA, to fit through these pores. And the myocyte cell itself can go ahead and create the protein through the mRNA that's coming through the cell. So it's really important to understand that mRNA vaccines are employing part of your body to make proteins that mimic the virus. So in no form are you getting infected with the virus, in no form will you get sick from it. The only thing you will feel is discomfort and your immune system responding to that discomfort. What you feel after the vaccine isn't because of what's in the vaccine. It has to do with your muscle cells aching and your immune system reacting to the achingness of your muscles. So I think it's important people know that, because the vaccine did come out quickly and people assume that means it's new. But what it does mean is that the technology existed and the government allocated funds to make these vaccines very quickly. And another reason the vaccine was made very quickly is because mRNA vaccines tend to be cheaper than regular vaccines. You don't have to get a virus, grow it up, and then, find a way to package it. You can deal with raw material to make the viruses, to make the vaccine. So it's important of like what's realistically fast and what actually went into it. The mRNA vaccine has been something that's been, thought up and tested for over 30 years at this point.
Absolutely. I was listening to the Daily, a podcast, and there was someone who was talking about how, they were trying to publish stuff on the mRNA. No one wanted to listen to them. Decades later, they couldn't find anyone to accept their research and papers, just really fighting to get information out about the mRNA. Here it is right now, because they did that research, because it was over 30 years, people have been working at it. We're able to have that right now. So for sure, not overnight.
Yeah,
it was a science.
It's funny you say that, because I remember 5 years ago learning about mRNA vaccines, and people frowned upon it because it's not a sexy technology. It's literally taking mRNA, injecting it into your arm, and then seeing what happens, essentially. And science, tends to like really cool stuff. They like to use really new stuff, but the old stuff works just as good. It's not as sexy, it's not as fancy, but it's effective, as we're seeing. So, a lot of people did have problems with publishing work with mRNA vaccines because it just wasn't novel, which is what they say in science. It wasn't new enough.
Yeah, and it's not hot and spicy, right? It's not glitter and gold.
Yeah, exactly.
So people don't want to do that. Dr. Nicophene, I'm gonna come to you, and then because Joanne, I want you to speak to what's happening with vaccine distribution in Haiti.
So we know that the Haitian government received 500,000 doses of the Moderna vaccine, and the distribution had started. So as of today, the Ministry of Public Health has provided a list of 18 sites where vaccine is being administered. And over 8,000 doses have been administered, and around 340 individuals have been fully vaccinated, but that full vaccination is with the Johnson & Johnson. Now, we know in Haiti, depo gen kontak, wap jwen so ap chèche ya. So there are lots of individuals whom even as far back as the month of March were able to get access to the vaccine. Now, how did the vaccine come in the country? How was it stored? There's no information. How is this being tracked or monitored? I do not know if there's an infrastructure for that. We also know there are many Haitians who were able to afford flying outside of the country to go take the vaccine outside of Haiti. So as of now, like I mentioned in my presentation earlier, because there's this lack of transparency, this lack of data management, I am unsure whether we actually know what percentage of the population has had access to the vaccine. Now, there's something that you brought up earlier, Santra, that is, the hesitancy towards the healthcare system. But I think something that we should also address is equity. Yes, the vaccine is available, but not everyone has access to that vaccine. And when it comes to public health planning, and it's not just public health, it could be like public administration in general, we oftentimes disregard the importance of recognizing communities that have been historically left aside. So when it comes to the history of a particular culture or group of individuals, when it comes to the human rights violations, how is that acknowledged in that space? And how do we resolve or mitigate those issues that we are still ignoring today? So I'll stop here, and if there's any follow-up questions, I'll be more than happy to answer them.
Thank you for sharing that. I was listening to a good friend of mine's, Ebony Crispin, with AIDS Healthcare Foundation, and one of her panelists talked about, imagine if Black folks had access to, if folks just had primary healthcare providers, relationships with them, this was the norm, would it be so difficult to get them to understand what we're experiencing right now? And what I would go out again on a limb to say is, I can imagine that folks who have personal relationships with healthcare providers, people who they've been seeing for 5-10 years, are folks who get it, who their doctors can be like, we have a relationship. I'm recommending this. And they're like, yep, I get it because I trust this person. And so again, you're speaking to what happens when when our systems are not equitable and leave certain people out, and how difficult it is to move people in times of crisis. And so that is a huge point, Joanne. I appreciate that. Dr. Nicophene, let's go to you.
I'm very happy to hear you bring that up, Joanne, in Haiti, that it's about the contact. It's the same thing in the United States, unfortunately. I've had patients who got vaccinated before I did, and they live in these gated communities, over 50s and older, and somehow their board or HOA knows somebody who rubs elbows with somebody. It's the same thing here. And so I did say earlier that COVID is a disease of the unvaccinated, but we've also found that COVID is a disease of the socially disenfranchised. It's mostly us, this skin color, and people who are socioeconomically disadvantaged. We are the ones who are getting COVID at the highest rates, but also we are the ones who are more likely to die. And it's partially because we don't have access. For a long time, we didn't have access to testing, but way before the vaccine, right? Now that we have the vaccine, a lot of people don't have access. But secondly, right, there's the distrust of the white coat. And most of the people in the white coat are not our skin color. So I can understand the distrust there. So again, I can't speak more to educating yourself and taking the time, listening to this panel. There's people who will give you examples. For instance, I have patients who have hesitancy over the vaccine, and they'll tell me, well, I know of this person, I know of this thing here, I know of what this person said. Are they doctors? Are they researchers? What are their background? Or they might have an example of something negative happening, but that is not the global picture. And that's why even if you know of an example, an isolated example of something negative happening, this is why I say to still do your research and know the facts. Go on the computer, look things up on WebMD, Cleveland Clinic, where you will see, even if you heard one bad thing, if you know that 99% of the people in the hospital with COVID are unvaccinated, right? Then this one thing is that 1%. So don't only trust these anecdotal things or this one instance that you've seen. You have to look at the global picture. And that is the goal. We're trying to reduce this on a global scale. So that's a very important point.
That's amazing, Ludmilla. I'm going to come to you in a minute because the questions are coming in and we got about 15 minutes left. We got a few. Can teas cure COVID? I want someone to take that. The infamous Johnny Celestin from New York asked us, can we speak to the Tuskegee study and vaccine hesitancy? That's another question that came up. And then Anna, who's been following us, asked another question about what are the risks to vaccination and how do we mitigate that? So 3 questions. I'm going to put them in the chat so that folks can take them as they need it. Let's start with can teas. You know, the ASO will see, gingembre. I know all of my friends' parents have jugs of stuff in the refrigerator that they've been refilling since last March. And that is what's been keeping them. Who wants to speak to that? I'm sure Dr. Nicophene, let's go to you.
I grew up like this, and there's some people who are on who know my father. Growing up, there was always something in the refrigerator that tastes bad. No one else is going to touch it. And it's his natural remedies. And they are effective. You know, this honey with citron and a little bit of rum in it, and I'm way too young to be drinking this. It worked when I had a cold. It helped my symptoms. So there's the point there. When it comes to teas and herbal remedies, they're great for symptomology, like for symptoms that you're having. They improve your symptoms. They make you feel better. There's less runny nose. You can get some sleep. There's less cough, but it's not a cure. It doesn't fight the virus or the bacteria. It just helps you deal with it better while your body's fighting, which is the same way cold medicine would. However, this is an herbal remedy, and that's the only difference. So teas will not combat the virus, but teas could help you feel better if you have the virus. And I had a patient who told me that too when she didn't want to get the vaccine. And I explained to her, the teas are great. They can prevent, if they build up your immune system, that's great. They can prevent, and they can help you if you have the virus with your symptoms. But it will not keep you from getting the virus, and it will not keep the virus from getting worse and you ended up in the hospital and potentially dying. And so the vaccine is much more effective in that way. And how do we know? The numbers, the statistics that we have. This mRNA vaccine, it's just amazing. And we did talk about how the goal is to make more money and the American healthcare system. But just like she said, the mRNA vaccine is not sexy. It's not the best way to make a lot of money. It's relatively cheap, and it's very effective. In the past, what have we done? We've killed the virus and injected in you, or we weaken the virus and then inject it in you. Those things are more sexy. Here, this is a special virus where, a special vaccine where it's not the virus at all. It's just a copy. There's the DNA of the virus. They took a copy of it and they inject you with the copy. And then your body recognizes that this does not belong here. That's your body's job. What belongs here? And once your body notices something is there that doesn't belong there, it mounts a response, it fights it. So this is another point. When people get sick from a bacteria or a virus or a fungus, it's not necessarily the bacteria, the virus, or the fungus that made them sick. What truly made you sick is your body reacting to it, because your body recognized this virus, bacteria, fungus doesn't belong here. And so it starts to, your body heats up. The fever is to kill off the virus or the vaccine, or the virus by the heat. The swelling, all of that is your body fighting it. So that's why you get sick. So even when we give you the vaccine and you get a side effect, I don't really like to call it a side effect, because that's what you want. When we're injecting it here and your body notices that this doesn't belong here, you want your arm to swell or maybe turn red and maybe feel a little heat there, like there's a fever, and to feel a little achy here, because that's a sign that your body recognizes this doesn't belong here and is now doing what it needs to do to fight it. And now, if COVID ever gets inside, if you're ever exposed with actual COVID, because your body already saw this DNA previously, your body's ready, and it's ready to mount the response faster, more aggressively, and that's what keeps you from getting severe disease, ending up in the hospital, or dying.
Absolutely.
So,
that's amazing. Thank you so much. That was clear. I learned a lot. I also want to honor Anna, who's asking tough questions, right? And she says, I have several people who've gotten severely ill and one disabled since being vaccinated. So this is personal for her. None of them have ever gotten COVID at all. So folks who haven't experienced COVID, who've gotten vaccinated and have had severe reactions to this. What would you all say to this?
So that goes back to the question about what are the risks to taking the vaccine. So in general, most vaccines. So for me, when I took the first shot, it was just like when I had the flu shot, sorry. I just get a little tender here for 2 days and then it's gone. And so that was the first vaccine. That's all it did. Why? We just talked about that. Is because my body mounted a response. The second shot, most people felt more. Why? Because again, my body's already knowing what it needs to do. So the second time that mRNA entered my muscle cell, my body was ready to go. And so it revved up something even more aggressive. And so that one, the next day I was at work and I got muscle aches and I was kind of feeling like I had a chill. And then I got home, I took some Tylenol and I worked out. That was it. So in general, the risks to the vaccines are these side effects that are very minimal. And if you feel something, it's no more than 24 hours. And the biggest thing I tell my patients is whatever you get from the vaccine is better than COVID. So if you don't feel well for 24 hours, then that's nothing compared to what we're seeing happen to people if they actually get COVID. Now, these examples of more severe people getting much more severely ill, I would like to ask more questions because I'm used to seeing this. Patients don't want to take the flu vaccine because they'll say, well, the flu vaccine gave me the flu. And I learned over time to ask questions, because then I'll say, so when did you get the vaccine and when did you get sick? Oh, well, I took the vaccine and then 3 months later I was sick. And so I started to learn that people sometimes associate things with a vaccine when they're unrelated. If you got the vaccine 3 months ago, 3 months later, whatever happened to you has nothing to do with the vaccine. So I would like to ask more questions to get more into details as to the stories that you have to try to understand and pick at it and see if this is truly a side effect of the vaccine. Because I've had patients too. A patient recently said, well, after the vaccine, I started getting wrist pain. And I said, well, how many, you got the vaccine? He said, yeah, I got the first one, I got the second one, everything was fine. And then this started happening. And I said, again, if I don't ask the question, I won't know, right? So I'm like, okay, so how much time passed between the vaccine and when you got this? 3 weeks. 3 weeks later, some pain in your wrist has nothing to do with the vaccine. So I would prefer I don't think that you're going to want to go into details here, but I'd like to get your information and have a conversation with you so we can determine whether the vaccine is truly what caused somebody to become disabled or get more severely ill.
Yeah, thank you so much for that, Dr. Nicophene. I think that, one, I want to share so much love and also respect for you really asking the tough questions tonight, Anna. I think also one of the things that we don't often think about is that there are folks who have adverse reactions to medication, Tylenol. Some folks can take Tylenol and some folks, it is not for them. However, what we know is that for a majority of folks, majority of the, let's say, vaccines or medications, folks are assessing whether or not this is good for you and whether or not you can take it. The other thing I will add is we know that when folks have compromised immune systems, right? When they have comorbidities, when they have chronic illnesses as well, that complicates things as well. And so I would add that when Dr. Nicophene and Anna, when you all have this conversation, to also, we may not necessarily know people's health history, what they're experiencing, to really kind of think about what also may have caused, if it is related to the vaccine, a reaction that is not what majority of folks experience. It's again in that 1%. And what I would say to young folks is that, the probability is really what we got to think about and talk about, is that what is the probability that you will be in that 1%? And often, we fly, right? And what we're saying is when we are not vaccinated, our parents are watching us, they're saying they're not vaccinated. Our aunts are like, bon, si Santra pas vaccine, et moi-même, la l'école, les connaissances, l'équipe boss, I have to own that responsibility, that the decisions that I'm making also impacts my family, because they see me as an influencer, and all of us are seen as influencers. And so we want to take those into consideration. I hope that is helpful, Anna. Thank you. You're very welcome. I think there was one more that was added. And welcome back, Ludmilla. I know you had a little issues there. One more, and we'll have to start to wrap. What are y'all saying to the folks about the Tuskegee study? There are many studies. I know folks are talking about, Black people who lose organs in the Black market. They want to just take our organs. People who, how the field of gynecology was started. There's also the Tuskegee study that also comes up. What are our responses to folks who, again, this distrust of the field?
I would say that the distrust comes from somewhere. You just acknowledge a lot of kind of public health violations, ethical considerations that, shouldn't have happened. And the example that I always like to use is going back to gynecology and how the father of modern gynecology developed pap smears and other procedures on Black women, enslaved women without their consent, mutilated them, and they had severe infection. That's a fact that we can hold that in one hand. But on the other hand, does that mean I'm not supposed to get a pap smear ever? Especially considering the health disparities in cervical cancer and how Black women have some of the worst outcomes. So despite the fact that, yes, all of these horrible things have happened in the industry, when there is a solution, when there is some kind of a procedure that can help us or prevent disease, I want to be first in line. Because all these Black women that have been made martyrs of because of these experiments, because of the lack of ethical consideration, when there is something that works, I need to be first in line, because once we've discovered that the burden of cervical cancer is so high, specifically for Black women, that doesn't mean that I opt out. That means I have to ask all of those tough questions. I'm going to go to the doctor's office and be like, hey, what does that tool do? Can I see my lab results? Will you talk through my lab results with me? How do you make this a comfortable experience for me, and ask more questions? So I think it gets down to holding two truths at the same time. And going back to Tuskegee, that was really about refusing a population a solution that they knew worked. So the people in the Tuskegee experiment, they came in with syphilis, and antibiotics had already been discovered as a solution for that. And instead of giving them the antibiotics, and they just discovered, hey, penicillin works for this, they decided to just look at the natural progression of syphilis and see, how bad does it get? Like, what are the repercussions of a long-term syphilis infection, which is highly unethical, obviously, but it was less about injecting them with the disease and more so watching how a disease negatively impacts people when they had a cure. And so when we use that as a reason for not getting the COVID vaccine, it's not exactly the same scenario. I know a lot of people are like, well, what if they give me COVID? Well, Tuskegee is not a good example of kind of being infected with something, because that's not really what happened in that instance. But I really just urge people to say, yes, bad things have happened, but what are the questions that I can ask? What's the research that I can do to kind of get familiar to make health decisions for myself? And going back to Santra's point about fear, there's been a lot of fear and shame and uncertainty around the pandemic. And we kind of have to go back to basics and ask ourselves, so what can I control? How can I make sure that I'm staying safe? I can wear a mask, I can social distance, I can wash my hands, I can get vaccinated. And all of these are kind of like in our sphere of influence, and just realizing that we do have an opportunity to make an empowered choice.
I want to add something right before Joanne, and then we begin to close out. A few years ago, I made a conscious decision to ensure that all of my providers, I feel comfortable with them, right? That I trust them, that that when they tell me things, I can feel like, and know that it's the truth, right? And so I think that if you don't and can't afford and don't have access to healthcare providers, you might have friends. I'm gonna say on some, it's willing to connect you all with folks that we know who may be able to consult with you outside of the traditional, the traditional healthcare, visit. And this is what we're here to do. I think that, the physicians that I have, I trust them. I know them. They want what's best for me, and we have relationships. And so it allows for me not to think about the harm that's been done. Historically, it allows for me to say, hey, there's been advancements where, Dr. Nicophene look like me, eat what I eat. Family might be from the same part of Haiti. We might be cousins, right? And it allows me to connect in a deeper level, but also, trust her and understand that she gets me. And I think that wasn't the case 10, 20, 30 years ago, specifically in South Florida. There is an opportunity for us to forge relationships with providers that look like us. And I'll just say one last thing, and this is like, Black doctors are a vibe. The waiting room is a vibe. The playlist is a different vibe. And I think, these are things that are really important, and it's a privilege because that wasn't true for our, the folks who came before us. Joanne.
I wanted to add some more to the Tuskegee. I think for as long as we are dealing with reluctance or distrust, that means there's an inequity issue. And when we think about public health should be seen as a human right or access. So I think what we should, not just us on this panel tonight, but even those who are watching us, I think it's important, in addition of building that comfort level, to ask the uncomfortable questions, to have those conversations within our respective networks, so that, because there might be a question that is worth asking my physician and I have no idea that I should be asking this question. And I won't know about this question until I actually have open conversations with like a neighbor or relative or friend or colleague. So making sure that we are creating that welcoming space to have those conversations so that we actually know what are some issues, uncomfortable issues that we should be pushing forward.
Thank you so much. Today is Black Women's Equity Day, and it speaks to how this is the day and the year where Black women starts to make what everyone else is making. It speaks about the pay equity that exists. Not only we're talking about equity in the healthcare field, but there's also inequity and so many other things that we're dealing with, and we still commit to going to work. We still understand that there's work for us to do. So I wanted to name that while I ask y'all to come off of mute and tell folks how to find you, how to hire you, how to support your work, and how to learn more about all the amazing things that you all are doing. I want to start with you, Cassandra. You've been amazing, definitely. How can people find you? Do you want to drop social handles? All the things we'll share it as well.
Yeah, so you can find me on Facebook, Cassandra Bazile. You can also find me on Instagram. I'll share that information with you, as well as my email. Please feel free to reach out to me regarding anything. I was so happy to be part of this panel today. Thank you.
Thank you, Cassandra. Let's go to you, Joanne. How can people find you? How can they support your work?
People can find me on Twitter at Joanne Perodin, and I'll drop my Twitter handle in the chat. There's also the website. There's a contact form if anyone wants to collaborate. That's COVID19Haiti.com. And again, I want to thank Vaccinations for giving me the opportunity to share this precious space tonight with all of you. It's been an honor. Meeting you, Dr. Nicophene, Cassandra, Ludmilla, reconnecting with you, and Santra, of course. We talk almost every day now, so thanks.
Thank you, and I'm super excited for you, Joanne, and all the things that you will do. Dr. Nicophene, how can people find you and support your amazing work?
Well, currently I work with Chin Senior Medical Center. So these patients have Medicare Advantage plans. So most of them are geriatric, 65 or older. There are some young people, but in general, to have Medicare and you're young, you'd have to be disabled. But actually, I'll be switching over to a new role with Ford Healthcare in November, and this will be a practice for 18 years old and over. It'll be in Miami, and so definitely going to be looking to grow my panel. I'll be available to anyone. I'm really interested in just helping and educating people at any time. So I will definitely leave my email. I'd like to have a conversation with you, Anna, and you could reach out to me at any time. I really don't mind it, and I appreciate it.
Absolutely. Thank you, Dr. Nicophene. Appreciate that. And Ludmilla.
So I am on every social platform. I'm on Facebook, Instagram, LinkedIn. You could find me by my name, Ludmilla Paul. And just some things that I'm working on. Obviously, I'm a board member of Vaccinations, so I want to go ahead and plug our summit in November. And also, I'm a data science fellowship. I'm a data science fellow with this organization called Correlation One, and we are looking into some COVID trends and really along some of the same things that Joanne was talking about, using the data to tell a story and make health decisions. So that's my forte. So I'll drop my information in the chat as well.
Thank y'all so much. So a few things as we wrap up. We know it's complex. We know for folks who haven't had access to healthcare systems that it's a lot coming at us. And we also want to hold at the same time that to whom much is given, much is expected, right? And so we have a responsibility not only for ourselves and our health, but for those who see us as influencers, because we've been making decisions since we were young for our families. We've been telling them, we've been introducing them and helping them to navigate these systems. So we want to take that in consideration because we know that when we get sick, especially folks who are unvaccinated, it can be fatal, right? Dr. Nicophene shared so many resources in terms of resources that are not YouTube, WhatsApp, but resources that we consider to be factual that you can really trust. So trusted resources. Joanne is really key in making sure that we understand what's happening in Haiti in terms of the dashboard, but also how vaccine distribution is happening. Because again, as a diaspora, we not only send dollars, but we also ensure that our folks have the information that they need to keep themselves protected. Cassandra, who really helped us to understand the science of vaccines and how the healthcare industry and science is not the same thing. That was super helpful, and your analogies were so helpful. And again, these are all things that we can hold because we're human beings and we're able to hold multiple truths that, yeah, this is a system that many of us haven't been able to access. Yes, this is new. And when we get sick, when we are unvaccinated, it can be fatal for us, right? And so these are all the truths that we're holding. Ludmilla, thank you so much for gathering folks. We could not be here without you. I appreciate you all so much and hope that you all have an amazing evening. And for sure, the panelists, if there's anything Avancé can do to support your work, we're definitely there. 10 toes down. Appreciate y'all so much. And everyone have a great evening. If you all have any other questions, we'll share this through emails, all their contact information so you all can reach them as well. And lastly, I gotta say, want to shout out Ms. Gypsy Metelis and Santra, who's a partner with us, who's trying to get the word out in the Haitian community. Ms. Gypsy also had a loss, so our condolences to Ms. Gypsy as well. And again, good evening, and we hope you all have a great evening. Bye-bye.